Hi, everyone. I'm Amy Doneen. I'm the co-founder of the Doneen Method. And I thought I would sneak back into my office really quick because I've been getting a lot of questions today and yesterday via email and also on patient visits regarding the latest public media regarding aspirin usage. The Wall Street Journal and the New York Times, which I have here, patients brought in, are really challenging the idea of aspirin use, and they're using the word I'll just read the headline: daily low dose aspirin no longer recommended by doctors if you're healthy. The words "if you're healthy" are really what are up for grabs. One thing to keep in mind: aspirin has been around for a long time. It is over the counter, but it is a very dangerous drug. The bleeding risk of aspirin is significant. Upwards of 3 to 5% of people who use aspirin for heart-related ailments suffer serious GI-related bleeding. So we do not take the decision to place someone on aspirin lightly at all. The question becomes, though, you do not have to wait till you have had a heart attack or a stroke to know if you are healthy or not. The challenge is just to understand how sneaky this disease is. It starts out like this. It's silent in the artery wall. No one feels this because there's adequate blood flow. And if plaque is hiding in the artery wall at any point in any time, if someone's not treated properly, including using aspirin, this can happen. And if someone gets a plaque rupture and a thrombus, and let's say that blood clot or thrombus blocks the flow of blood right here, all of this muscle is not going to get oxygen, and we risk dying of a heart attack or needing a stent or a bypass. If this clot occurs and it blocks blood flow to the brain, we will call it a stroke. So waiting for someone to have a heart attack or a stroke to know that they are no longer, quote, healthy, in our opinion, is really part of the challenge with the current medical system of placing us in a binary system. You either have had a heart attack or you have not. And what the current literature is challenging is, what is the definition of healthy? We would argue if you have plaque in the artery wall, you need protection against that plaque rupturing. And there's lots of ways to find out if you have plaque in the artery wall. It certainly isn't by looking at the opening. So whether you're looking at the opening here or here, what you really need to do is appreciate testing that looks for plaque in the artery wall. We use technology like carotid IMT testing, coronary calcium testing to know that. And if someone's got plaque, of course they need a baby aspirin. They are not safe. These trials that the New York Times and MSN and Fox News and USA Today are talking about actually were published in September of 2018. So it's not new data. There's the Aspire trial, the Aspirin trial, and the Ascend trial, all challenging the idea that aspirin usage is good for everybody. And I agree with that. It is not. You've got to prove you have plaque before we're going to put you on this dangerous drug. The bleeding risk that they cite is around 3 to 5%. The pooled analysis of aspirin therapy reducing cardiovascular events, you'll see anywhere around 20 to 35% event reduction. With that being said, the data that these trials utilized too, I want to point out, they used around 100 milligrams because it was a multi-world study, Australia, all over, multi-centers around the world, and 100 milligrams is usually the dose that is in these trials. We have the ability in the US at least to prescribe 81 milligrams aspirin that is coded. So the idea that people on a lower dose makes us feel a little bit comfortable, number one, or a little bit more comfortable, number one. And number two, if someone is prescribed aspirin, what we do is what's called an aspirin resistance test. We want to make sure that they're getting adequate benefit from that aspirin, that they're not at a significant bleeding risk, and that they can maintain their safety on a very low dose profile. So I hope that helps. If someone is walking around with plaque, don't wait until it has misbehaved to prescribe aspirin. But in order to know if you have plaque in the artery wall, you're not going to feel it. You need to do testing. That's why people are fine on Wednesday and not on Thursday. You need to get a carotid IMT test. You need to get a coronary scan. You need to find out if you have plaque. So the definition of health is what's in question. We would propose don't wait until a blockage to know if you are healthy or not. Okay, I hope that helps. Everyone have a great day. Bye-bye.